Hello and welcome to the Dragon Shed for Save a Life September. I believe that first aid should be taught in schools as young as possible. There are thousands of accounts of children saving their parents' lives because they've had some education of what to do in an emergency. This series of tutorials is intended to give everyone the basic knowledge with which they can save someone's life, or at least provide appropriate treatment in an emergency. This is no replacement for a proper first aid course, and I suggest that you all endeavour to attend at least one every 5 years or so, whether through your workplace or if you seek out one of the charities that run them locally to you. An emergency first aid course only lasts about a day and will cover the bare minimum, which is kind of what I'm pricing here. In first aid courses, as with other types of teaching, we find it useful to use acronyms. And in first aid, the acronym of choice is Dr. ABC. So we'll begin with the D and the R. First, danger. The particular thing to remember here is look after yourself first. It sounds like cowardice, but this is a vital part of the safe practice of first aid. Always look for danger first. Now, danger can take many forms. First, it's the environment. Are you outside, inside, night, day? Is it cold? Is it wet? Be sure to look around, above and behind you for things that could cause you harm. Now, that's not necessarily moving vehicles, it could be people. Always be aware of the axe murderer that may be sitting behind you. So second is the casualty. Do you know how they were injured? Did you see it happen? If they're fallen off a horse and the horse is bolted, then you're pretty much safe. But if they were hit by a car and they're still in the road, you need to think about the whole situation. Also think about whether the casualty is likely to hurt you. Are they drunk, drugged or acting oddly? Then you might want to back off slightly, or at least get some backup first. Third, yourself. Is your help actually needed? If there are paramedics already in attendance, do you need to go barging in? Do you need to provide your help, which will not be help at all? If there is a movable danger, if there's something there that they are being crushed by or whatever, can you move it yourself, or do you need assistance? Again, don't go diving in on your own if you don't have to. If, for any reason, you do not feel comfortable, you do not have to approach. If you do not feel safe, you do not have to approach. If things change and you no longer feel safe, you can and should step away. It is much better to have a live witness who can give information to the authorities than another casualty for them to deal with. It is real life, not the movies. So you've checked for danger and satisfied yourself that it's safe for you to approach. Now you need to yell for help, like they do on telly. If you know there are people around, call for help. And that's the second most important part of first aid. Make sure it's safe to approach and then call for backup. Whether you just need a friend or an ambulance, you need a response. In this day and age, you can reach into your back pocket for a phone, call for an ambulance, but you can't do that if you dive in and get yourself injured. It's not cowardice, it's common sense. And something to remember for general safety of any incident: if you don't know what the cause of the injury is, you follow the rule of 3. 1, if there's one casualty, call for help, approach with care. 2, if there are 2 casualties, call for help, make sure it's coming, and then approach with caution. 3 casualties, do not approach. Call 999, 911 or whichever and provide information to the emergency services. So, that's the beginning of this series, the first steps of first aid. D, danger. Check for danger, dangers to the patient and to yourself, and do what you can to make things safe. R, response. Call for help. Get a response from someone. You may not need an ambulance, but it's always wise to have an assistant or a witness. So on Wednesday I'm going to start with the ABCs, so see you then.